Welcome back to our three-part recorded series, part two, where we're going to be covering original Medicare, what it costs, what it covers. Again, if you need to email us, it's medicare@bouldercounty.gov or leave us a message at 303-441-1546. Okay, what we're going to cover in this section of the three-part series is original Medicare Parts A and B, what the premiums, deductibles, and coinsurance costs are, what coverage you can add to that original Medicare, and Part D prescription drug coverage. Enrolling into Medicare Part A and B is where you start your journey with Medicare. Enrollment is done through Social Security because they have your work and your tax records. Part A is your inpatient hospital coverage. Part B is your medical coverage. When Parts A and B are combined together, they're called Original Medicare. You'll hear that term a lot. Original Medicare Part A and B is portable. There's no referrals needed. It's not managed care. It's accepted nationwide, so you can go to any doctor that accepts Medicare anywhere in the U.S. or the U.S. territories, any hospital, clinic, or provider that accepts Medicare. And it's really important to understand that there are no referrals needed to see specialists under Original Medicare. Under Original Medicare, Part A is generally premium free for most people or anybody who has been paying the Medicare tax through employment for roughly 10 years. It's 40 quarters or 10 years of work history, and then Part A is premium free. Part B does have a monthly premium. It's $185 per month in 2025. That changes each year a little bit. Usually the new premiums come out around November. There are deductibles and there are coinsurance costs in Original Medicare, and really important to know that there is no maximum out-of-pocket limit. So there are ways to add coverage to your Part A and B to help with those costs, but if you have a $100,000 bill and all you have is Medicare Part A and B, 20% of that cost is going to be yours. If that happens the very next weekend, again, likely 20% of that cost will be yours with no maximum out-of-pocket limit. So we'll talk about ways to cover those costs, but if all you had is A and B, you need to know that your costs could be quite high. These are the monthly premiums for the different parts of Medicare. Part A is generally premium free if you have 10 years or 40 quarters of work history. If you have fewer than 40 quarters of work history, then you may pay a premium for Part A. You can check with Social Security to find out exactly how many quarters you do have. Part B is $202.90 per month in 2026 and is also subject to income related adjustment, which would also be paid to Medicare. It's a surcharge amount for high income earners, which we'll talk about coming up. Part D is going to be paid to the private insurance company that you enroll with, and the premiums vary from plan to plan. And Part D is also subject to an income related adjustment amount if appropriate. This is the 2026 IRMA chart. It's the income related adjustment amount. So they're looking at your tax return 2 years prior to determine if you will pay a surcharge in the current year. So in 2026, Social Security would be looking at your 2024 tax return to determine if you have a surcharge amount. If your income as an individual is 109,000 or less, you would pay the Part B premium of $202.90 and nothing more. Same if you are married filing jointly, less than 218,000. If, however, your income is on your tax return 2 years prior is, say, greater than 137,000 as an individual and um, less than 171,000 as an individual, then it's possible that you may pay a surcharge amount of $202.90 on top of your Part B premium of $202.90 and an additional $37.50 on top of any Part D premium you may have. If your income is greater than 500,000 down here in 2024, then you may pay an additional $487 per month on top of your Part B premium and an additional $91 on top of your Part D premium. This is not a lifetime surcharge. This will change every year. So you may pay a surcharge amount 1 year and not pay it the next year. And it is always a rolling look back on your tax return 2 years prior. So if I sell Grandma's Farm in 2026 and have a flux of income, it's possible that I may pay a surcharge in 2028. You'll be notified of this in the fall each year from Social Security if you have a surcharge amount. You can appeal it. The appeal is done through Social Security, and we've seen them go anywhere from 4 months to deciding on appeals that were submitted all the way up to taking 2 years. You have to pay the surcharge amount while you're in the appeals process, but if they find in your favor, they will refund what you've paid in. Now on to the deductibles in 2026. This is what you're going to pay before the cost sharing begins. So for Part A, the deductible this year in 2026 is $1,736 per 60-day benefit inpatient in a hospital. So that's anywhere from, if you've been admitted as an inpatient, anywhere from 2 days all the way up to 59 days. So if you know anything about hospital costs, that's a pretty good deal. It is possible to have more than one benefit period in a year, depending on how far apart your hospital stays are. Part B has an annual deductible, which is $283 this year. You pay that the first time you receive Part B services, and then after that, the cost sharing begins. And your deductible is waived for the preventative services like mammograms, pap smears, bone mass measurements, prostate screening, diabetes tests. There's a whole list in the Medicare and U book of preventative services. Part D, prescription drug coverage, has a maximum deductible that's set by Medicare each year. This year it is $615. So most of the plans, when you're talking about generic or preferred generic medications, they'll cover those right from the start without requiring you to meet the deductible first. But if you have a more expensive medication, the plan is going to say, we want you to pay this $615 before we begin the cost sharing. And we'll go into Part D plans a little bit more coming up. On to coinsurance and the amount you're going to pay in 2026 when you're accessing your Part A and B services. That Part A inpatient deductible of $1,736, that was for a 60-day benefit period on the previous slide. If you were unfortunate enough to be in the hospital longer than 60 days in a row, beginning on the 61st day, you would pay a per day charge. And you'll see there from day 61 to day 90, you're going to pay $434 a day. Day 91 to 150, 868 per day. And then all costs inpatient hospital, if you were there 150 days in a row, after that, all costs would be yours because then it's considered to be long-term care. Skilled nursing, you're going to start a per day charge on day 21 of $217 per day. And then anything over 100 days in skilled nursing, all costs are yours, again, because it's considered long-term care over 100 days in skilled nursing. Part B, your medical coverage, Medicare is going to pay 80% of approved claims, and you'll be responsible for 20% of the Medicare approved rate. We have a note here about unassigned claims, which are unusual to see. I know somebody that goes to a lot of different specialists and has never received an unassigned claim, but it does happen. So it's important that you ask the question. If a doctor accepts Medicare assignment, that means that they agree to charge only what Medicare allows for the service. But if a doctor accepts Medicare but doesn't accept assignment, they will charge 15% above the approved Medicare rate, and then you would be responsible for the 20% plus 15%. So it's always good to just ask, do you accept Medicare assignment so that you know. So what all does Medicare Part A cover? It's going to cover the inpatient hospital care that we talked about on the previous slide. We'll also cover blood, home health care that is associated with an inpatient hospital stay, skilled nursing facility care that we talked about also on the previous slide. You're not going to pay anything for the first 20 days if you were transferred from a hospital to a rehab facility and you had that 3-day minimum qualifying hospital stay as an inpatient. This is really important, just to make sure you have somebody asking if you are in the hospital. Just ask the question, am I an inpatient? Am I being admitted? Because it is possible to, go into the emergency room or have outpatient surgery or something and have them hold you overnight under observation. That's not an inpatient stay. So make sure you're asking that question, especially if you think you might have to go to rehab before going home. So home health care and hospice care are also covered under Medicare Part A. Skilled nursing is not a long-term care, and Medicare does not cover long-term care. A lot of people think it's going to cover their long-term care. They'll just say, oh, I'm going to let Medicare cover that. Just know Medicare does not cover long-term care. Medicare Part B covers pretty much everything else and those things that we're accessing on a daily basis. It's going to be all of your doctor's services, lab work, MRIs, CAT scans, x-rays, physical, occupational, and speech therapy, mental health therapy. Something that might be new is DME equipment, durable medical equipment. That is your walkers, wheelchairs, some insulin pumps, oxygen, CPAP machines. Those are all covered through durable medical equipment. And what's really important there is that you are going to a supplier that accepts Medicare. We have had people order wheelchairs from Amazon. Amazon is not a Medicare approved supplier. So if you do that, you're going to be paying the whole cost of that equipment. If you have any questions about that, we're more than happy to review it. Just wanted to make a note that up at the top of the slides, there are notations for what pages in the Medicare and You book that these services are covered or reviewed in that book. We have some Medicare and You books. If you'd like us to mail you one, just leave us a message. Let us know that you took the recorded class and you would like us to mail you a Medicare and You book or send us an email. We're more than happy to do that at any point in time. It's kind of a good reference to have on hand. This is just a review of what you're going to for Part B services under Original Medicare in 2026. First time you access services of this year in 2026, you're going to pay the Part B deductible of $283. Once you've met that deductible, then it's going to move to the 80/20 coverage. So anything that's been approved by Medicare would be covered 80%, and you would be responsible for the 20%. When Parts A and B are combined together, they're referred to as Original Medicare. So that's still what all we're talking about is if you have only Part A and B Original Medicare with nothing else added. This is a list of some of the preventive services that are covered by Medicare. There are 20 pages in the Medicare and U book that cover preventative services, so I would definitely encourage you to order a Medicare and U book, request from us because we have them, we can mail you one so that you have a comprehensive list. All of the preventative services are designated in the Medicare and U book by the blue apple. We don't know why they used a blue apple, but an apple a day keeps the doctor away. At any rate, if you're accessing one of these services, there is no deductible, no copayment required. There's lots here. So mammogram screenings, prostate cancer screenings, colorectal cancer screenings. When it comes to your colonoscopy, if you have a colonoscopy and they don't find anything, they just do kind of the look-see, then it's considered preventative. If you have a colonoscopy and they snip a polyp or send something out for a diagnostic, then it falls into the cost sharing and you may pay a percentage of the cost for that colonoscopy. Most of your vaccinations are covered under preventative: Shingrix, pneumonia, hepatitis, COVID-19 vaccinations, flu. Your annual wellness visit, that's really just a conversation with your doctor. You get one each year. Think of it not as your normal physical that you would have, but more of a conversation with your doctor about your health care and what they want to track during the year or what concerns that you have. And then you may later have a medical visit that would be more like your annual physical that you're used to getting, where they take your blood pressure and order lab work. But the one annual wellness visit you get is just a conversation. What is not covered is just as important. So dental care is not covered by Medicare. This is routine dental care, like having cleaning done. Cosmetic surgery, massage therapy. Just a reminder, no long-term care or nursing home care is covered by Medicare. So routine hearing and routine eye care and eyeglasses is not covered by Medicare. A lot of people have questions about this because they'll ask us, well, what about cataracts or glaucoma? If you are having cataract surgery, that is going to be done by an ophthalmologist who's a medical doctor. That will fall under Part B. But if you're going to Target or Walmart or Pearl Vision to get a set of glasses or just have an eye exam, that's considered routine eye care. So, and done by an optometrist and not covered by Medicare. So just keep in mind that distinction: ophthalmologist, medical doctor, that would be covered. Acupuncture, we put this on here, but it's really only covered under very limited circumstances related to lower back pain. And what else? Oh, Medicare does not cover any health care outside of the U.S. or concierge care. So what do you do about that 20% in costs that you're responsible for paying? There are a couple of different options. You could purchase a supplemental insurance plan called a Medigap because it covers the gap between what Medicare pays and what you're responsible for. You may have retiree coverage from prior employment or TRICARE for life or federal employee health plan or union coverage, or you might have low income and possibly qualify for Medicaid that could pick up those costs for you. We're going to go into a little bit more detail on supplemental insurance plans coming up. Medigap supplemental plans are sold by private insurance companies. They're standardized nationwide, so if you purchase a Plan F, a lot of people have heard about a Plan F. If you purchase a Plan F or have a Plan F, it's going to cover all the things that a Plan F covers, no matter what company you get that plan through. And it'll go with you wherever your original Medicare goes. So if you're traveling to Texas and because you want to see a doctor at MD Anderson and you have original Medicare and a Medigap, you can do that. It's very portable. If you're going to live in a van for the next year, you might want to have original Medicare and purchase a Medigap to pay those costs you're responsible for. You have to have A and B in order to purchase a Medigap plan. And um, the first 6 months that you have your Part B benefit, you have guaranteed issue right to purchase a Medigap plan. This is really important because during that 6-month period, these plans cannot ask you any medical questions. They're just going to accept your enrollment as long as you pay those premiums. They will never deny or drop you. So once you're in, you're in. This is the time to do it. If you know that you have delicate health, if you know everybody in your family develops cancer at the age of 70, if you plan on traveling around the country, if you're a snowbird, if you know that you want to see a doctor at the Mayo Clinic in Minnesota, this is the time to purchase it. Don't wait. Once you leave that 6-month period, that guarantee issue right period, these plans can't deny you based on your answers to the medical questions. And the reason they can do that is because they're not your primary insurance plan. Medicare is your primary insurance. This is a secondary policy that you're purchasing. So it's important to get one right from the start if that's the way you think you want to go. Let's take a look at the Medigap plans that are available for purchase. So the Medigap plans also have letters. Medicare is a Part A, Part B. These are plans, Plan A, Plan B. Most people have probably heard about a Plan F or a Plan G. Currently, let me see if I can get my pen. The Plan F is not available to people newly eligible for Medicare. Plan F and Plan C, you had to have turned 65 prior to 2020. So the most comprehensive plan available now to purchase is Plan G. When we're looking at these Medigaps, you want to see the check marks. The more check marks, the better. The only thing that doesn't have a check mark in Plan G is right here. This is the red X, and this is the Part B annual deductible. So you would pay the first $283. That's the Part B annual deductible this year. And then after that, the rest of the year, Medicare is going to pay primary and the Plan G would pay secondary. And you're just responsible for paying the premiums. A Plan G right now, for somebody turning 65, whether you're male or female, the price can be a little bit different. It is generally based on your zip code and whether you're a smoker or a non-smoker, but figure you're going to be somewhere, if you're just turning 65, you're probably going to be somewhere between 140 and 180 per month, depending on the company. And that's in addition to your Part B premium of $202.90 per month. Also, the Plan N, a lot of people do like this one over here. Plan N may be a little bit less monthly. You're still going to pay that Part B annual deductible. It also doesn't cover any excess charges. That's if the doctor accepts Medicare but doesn't accept assignment, so wants to charge that extra 15%, then you would be responsible for paying that. In a Plan N, you're also going to have copays every time you receive a service. So there's a $20 copayment anytime you see a doctor. Best example of that is if you are receiving physical therapy, say you have to go twice a week for 6 weeks, every time you see that physical therapist, you're going to pay a $20 copay and then a $50 copayment on emergency room visits. So depending on how many services you access, Plan N may or may not be more cost effective for you. And we're happy to review these plans with you in detail. We can't help you enroll in them because it's secondary to Medicare and not Medicare itself, but we can provide you with an estimate. We have an actuarial system through the state that gives us a pretty good estimate and a lot of details about the companies that are offering plans, how many people they have enrolled, what their loss ratio is, that type of thing. So feel free to talk to us about it, but you'll have to enroll straight with the company or through a broker. So now if you have original Medicare with a Medigap, and what happens if you want to move to a Medicare Advantage plan in the future? Can you do that? Is it easy? It is super easy. You can do it in a year during the annual enrollment period, which is between October 15th and December 7th for a January 1 start. Super easy. Yeah. So if you're planning on traveling in a van for a couple years, or maybe I want to get my hip replaced or knee replacement, and I know that I want to go to this particular doctor. Maybe you start with original Medicare and a Medigap, and then in the future, you're going to be staying more in the area and you want to move to a Medicare Advantage plan. You can do that any year that you want, and the new plan will start January 1. All right, we'll start talking about original Medicare. So we've enrolled in Part A, inpatient hospital. We've got B, our medical coverage. We've added the supplemental or the Medigap to cover those costs we're responsible for. So the only thing left to do is going to be to add Part D, prescription drug coverage. Part D prescription drug coverage, this is for medication that you're picking up at the pharmacy and taking at home. So anything you're picking up at Walgreens, King Soopers, it's an oral medication, you're taking it at home. There are some self-injectables that you might pick up at the pharmacy and take at home as well. So these are provided by private insurance companies that contract with Medicare. And each one of these Part D plans has its own formulary. So Part D plans, as we said, help pay for your plans that you pick up at the pharmacy and take it home. Plans do have a monthly premium. There are 10 plans available this year in 2026. Medicare sets the annual deductible amount each year. This year it is $615. So most of the plans, if you're taking a preferred generic medication, something like atorvastatin, the plan would not require you to meet that deductible before they're going to share the cost with you, and they'll be very low cost when it comes to preferred generic and generic. If, however, you have a more expensive medication, a higher tier level medication, then the plan is going to say, we want you to pay this deductible before we're going to share the cost with you. So again, it's really important to make sure that you're enrolling in a Part D plan that has your medications on its formulary. And there are some qualifiers. You're going to want to look at prior authorization if there is anything required there. Step therapy is generally a little bit more of a problem if you see that, because it's saying that the plan wants you to try 2 or 3 medications before they give you the one that you want. There are quantity limits on some medications as well. Most people do fall within those quantity limits. And we can help you look at these prescription drug plans. We do it all the time, help people enroll. We're really familiar with all of the information they provide. Again, just a reminder that you only have 63 days to get enrolled into a prescription drug plan upon the loss of coverage. All of these plans also have star ratings, which are based on their drug and safety pricing, how the plan performs, customer service, what's your experience with the plan, and sometimes it does make a difference if you have one that has a little bit higher star rating. These are the 10 Part D prescription drug plans that are available in Colorado this year. You can see all the way over to the left is the star rating for the companies. We've never seen one that was 5 stars. 3.5 is the highest rating that we've seen on a drug plan. There are a couple of zero premium plans. If you look here in this column is going to have your plan premium. There's a zero premium one here and a zero premium one here. That means it doesn't cost you anything to be a member of the plan. The drug deductible is in this column. Most of the drug deductibles are set at $615. So with these plans, why would you pay $151 a month if you can be enrolled in a plan that doesn't cost you anything every month? Well, maybe this plan that's $151 a month is the only plan that has your medication on the formulary. So that's why it really matters, and that you should take a deep dive into your prescription drug plan. Make sure your medications are on the formulary of the plan. Make sure you understand how they're covered, what tier level they are, whether or not you're going to be required to meet the deductible before the cost sharing begins. We can help you review these again because we do this all the time, and we can also help you enroll in them because it is a part of Medicare. Over here in the column that says benchmark, there are two plans that are benchmarked that says yes. Those two plans, that means that if you qualify for extra help through low income, they may automatically enroll you in one of these two plans. And if they do, the plan premium will be at no cost to you, even if there is a premium. You'll see here that there's this one down here is $2.20 a month. It would be zero if you had extra help. The other advantage here is with these drug plans is that you can review them every year. We can't say that enough. Even if you have a plan this year, you should take a look at it during the fall open enrollment to make sure that it's going to be the best plan for you the next year, because these drug companies, they change their formularies every year and their premiums change every year. They can either go up, we hardly ever see them go down, but they do go up each year. This is a standard Part D design, so different phases that you'll go through when you have a drug plan. During phase one, that's when you're responsible for meeting the deductible, that $615. That whole cost is yours. And then once you've met that, you're going to enter what's called the initial coverage phase. And during that period, you're going to pay a percentage of the cost of your medication, and the plan is going to pay a percentage. Most of the time, it's 25/75, so you would be responsible for 25% of the cost, and the plan would pay 75% of the cost. The 615 is a part of this overall 2100 cost. So you don't pay 615 in addition to the 2100. It sets you on your way to meeting that overall maximum out of pocket. If you were to meet the maximum out of pocket, then you enter phase three, which is catastrophic coverage, and all costs are covered by the plan 100% at that point. Now, Part D does not cover some chemotherapy and immunosuppressive drugs because they're covered under Part B. Anything you're going to be receiving by injection or infusion in a doctor's office or a facility would be covered under Part B, not D. So if you're going to Rocky Mountain Cancer Center and you have infusions once a month or 3 times a week, that is going to be covered under Part B of Medicare. If you have an oral medication that you take at home, that is covered under D. So vitamins and over-the-counter drugs are not covered by Medicare, nor are weight loss, gain, or sexual dysfunction or fertility drugs covered under prescription drug Part D plans. So if you have prescription drug coverage currently, is it creditable? You may need to have verification of creditable coverage if you're over 65. If you're employed and receiving your health care coverage through your employment, most of those companies send out a letter letting you know that your coverage is creditable. You don't have to enroll in a prescription drug plan. We really think that you should, especially since there's an option for a zero premium plan. Get enrolled just in case something happens. We see that all the time. Somebody who didn't enroll in drug and then in the middle of the year all of a sudden something happens and their medication that they need is expensive. It's not a time of year when they can enroll, and then when they do finally enroll during the annual enrollment period, they're looking at having a penalty on top of everything else. So enroll when you're first eligible. Let us help you with that. We're more than happy to help. And then we just want you to know too that some retiree plans like federal employee health plans or if you had Paracare, they include drug coverage or they have creditable drug coverage within them. Some COBRA plans also have creditable drug coverage, even though COBRA is not considered creditable for not enrolling in Medicare Parts A and B. And as long as you have creditable coverage, you're not going to be penalized. Then we just want to remind you too that you only have 63 days to get enrolled into a prescription drug plan when your coverage ends. So don't wait the 63 days, please. You know, get it done in right away or let us help you. And at least contact us before that 60 days expires. Don't wait. This is the Prescription Drug Plan Finder, PDP, on Medicare.gov. This is where if you want to do your own research, you can. You would click on this tab down here that says Find Plans Now. Either, create your own account by entering your Medicare number and all of your information, where you can then enter your prescriptions and it'll hold that information. Or you can do a generalized search by entering your zip code. Or you can come to us. That's probably the easiest way to do it. We'll do all the work for you and provide you with an analysis of which plans might be best for you. This picture on the Medicare.gov website changes frequently, but we're keeping her for the year. She was on the page in January, so she's going to stay with us for the presentation for the rest of this year. If you have any questions about this, just let us know and we'll kind of help guide you through it. But know that you can do the research on your own if you wish, or come to us and we'll help you. We're coming to the end of part 2 of our 3-part series. This is the end of Original Medicare. So to be covered completely under Original Medicare, you're going to enroll in Medicare Part A and B, and you do that through Social Security. Then you would choose a Medigap supplemental plan or have some other coverage that pays second to Medicare, and complete your coverage by enrolling into a Medicare Part D prescription drug coverage. Once you have all that, you are fully covered under Original Medicare.